OutFront now, Alycia Halladay. She's the Chief Science Officer at the Autism Science Foundation. Okay, I can't think of anybody, Alycia, with a more appropriate title to know the facts. The Chief Science Officer at the Autism Science Foundation. Okay, so I guess let's just go to this basic thing. Is there a there on what the Wall Street Journal is reporting Kennedy is about to claim?
So there's really no evidence of a link, right? This has been circulating around for many, many years now. Yeah. There's been small studies that have shown a little bit of a link, but when you increase the sample size or increase the number of people in those studies and control for things like maternal health and background genetics, there is no longer an association. So it's not.
So it's not even that there's a causality.
No, it's absolutely not causative at all.
I mean, there's a correlation. There's not even necessarily a correlation.
There isn't a correlation with the right study. The right study design will show that there is no association.
Okay, which I think is pretty stunning. Because that's what I'm saying. Some people always say, okay, it's correlated, but it's not causality. You're saying actually it doesn't even meet the mark on correlation. But just that, as you point out, this has been out there for a while. I mean, this isn't one that Kennedy's just plucked out of the ether. Right. There was a Harvard study with the headline using acetaminophen during pregnancy, which is Tylenol and President Benadryl and things like that, may increase children's autism and ADHD risk. So, I mean, the headline kind of takes you there. But one of the doctors who conducted that study told the New York Times, we can't answer the question about causation. Ice cream sales go up in the summer and also violent crime increases during the summer. They're associated, but that does not mean that the ice cream is causing violent crime or vice versa, right? Both increase because of the hot weather, right? That it's the underlying condition that causes two completely unrelated things to go up.
Yes.
Right? I mean, is that essentially, it sounds like what you're saying. I mean, by the way, Tylenol's been around since the 1800s.
Yes.
If this were that simple, I don't think it'd be coming out like this, would it?
No, I mean, it isn't simple. Autism is a very complex disorder. Everybody who works in autism knows that. There is not going to be a single environmental factor that results in an autism diagnosis. And anyone who says otherwise is not aware of how complex and what of a spectrum it is.
So, obviously, we saw the Tylenol stock went down, right? Okay, immediate reaction. So some women may opt not to take Tylenol while pregnant. Now, of all things that you could do, that one doesn't seem to be the biggest one that would cause earth-shattering consequences in most cases. But the nation's top health official, right? Top health official, with all the gravitas and credibility that should imply in the most prestigious health agency in the world, confusing science. That is something that's much bigger on whether or not to take a Tylenol.
Absolutely. I mean, the bell has been rung, right? So now Tylenol has been linked with autism by the HHS director. So, of course, people are going to listen and people are going to be careful. However, the American College of Obstetrics and Gynecology has even pointed out that they agree that you shouldn't take a ton of Tylenol during pregnancy, that in fact, if you are in pain or there is a reason that you need Tylenol, that you should consult your doctor. And some of the studies that were included in that report showed that if Tylenol is given for a fever for a short period of time, it can actually be protective against neurodevelopmental disorders.
No, so there is a risk.
Of fever. So fever and illness has been linked to neurodevelopmental disorders. People may be taking Tylenol to mitigate that. So in fact, it could be protective.
Right.
But even ACOG says don't take it for a month. Don't take 10 a day for a month because it does have effects on your liver. So it's not as if ACOG is giving everybody the green light to take as much Tylenol as they want. Talk to your doctor. Talk about why you need to take Tylenol in the first place.
Right. All right. Well, thank you very much. And by the way, I misspoke when I said that it was an active ingredient in Benadryl. So I just want to make sure I want to make sure that everyone knows that was a misspeak by me. Thank you very much. I really appreciate your time.
Thank you.